Almost 20% of Texans are uninsured, the highest rate in the country. Expanding Medicaid, as 38 other states have done, would return Texas dollars back to Texas, plus cover 1.5 million Texans at 90% federal cost. But the idea remains unpopular with Republicans because of fears the state could be left holding the bag in costs. Plus, the expansions are part of the Affordable Care Act, so-called Obamacare. But with a new legislature and a new president, the ground is shifting. The 1115 waiver, which was the state's way of pulling down funds without expanding the program to cover more Texans, has been revoked by the Biden administration. Laura Guerra-Cardus of the Children's Defense Fund of Texas said this could allow more public input into how the state uses funds.
It is funding that we got about a decade ago, around when the Affordable Care Act got passed. And one of the purposes of it was to prepare our healthcare delivery system to receive a lot more Texans who would now have healthcare coverage and be accessing the healthcare system in a different way. When the Supreme Court judged that Medicaid expansion should be a state option, as we all know, our state has for the last 10 years chosen not to adopt the Medicaid expansion option. And so the 1115 waiver has provided very critical funding for our state to keep our hospitals whole, to prop up our safety net, and amongst many things, be able to treat uninsured Texans when they show up in the emergency room.
With that clause, there's more financial pressure on the state, right?
Right. So, I think the interesting things to know about this, our last 1115 waiver application, is that it was done in a very rushed way in the last few weeks of the Trump administration, and it skipped the public notice and public comment period. So a decision was suddenly made that was going to apply to the next 10 years of healthcare funding in Texas in a way that didn't go by the rules and regulations that govern this funding. And so that is that's, I would say, probably the main reason that the Biden administration has announced, since January, that they would be revisiting what are being called, the 11th hour waivers approved by the Trump administration, not only in Texas but in other states, and reviewing them to see if they followed the rules, and that and if things needed to change, especially when they're approved. 1115 waivers are normally approved for a few years, maybe 5 years, but 10 years is really unprecedented. And so now what we have is an opportunity to resubmit a new application. We have about 18 months to do so. The funding we get today will continue until September of 2022. And it gives plenty of time for a transparent process that has the necessary public comment period and allows all of the voices to take part in a really big decision for our state, which is how we fund our healthcare system, how we fund care for currently uninsured Texans.
Stepping into this opportunity, State Representative Julie Johnson of Dallas County introduced a new waiver funding bill. HB 3871, known as the Live Well Texas bill, would cover 1.5 million Texans through Medicaid. It includes escape clauses if the federal government reneges on its commitment. It's also backed by 200 business, medical, and government groups, plus 70% of Texans who favor Medicaid expansion. It even gained bipartisan support in the House, but it did not reach the floor, victim of a packed legislative schedule and a lack of enthusiasm by House leaders like Speaker Dade Phelan.
Texas has now achieved kind of a critical milestone that we have kind of on paper, documented proof that the majority of the House supports a coverage option, passing a coverage option for Texas. And we know that because of the support to the Live Well Texas bill, House Bill 3871. We have, Democrats supporting it, plus now it's 9 Republicans. It went from 7 to 9 last week. And we are hoping that actually it gains more support in the House, more Republican support even in the next few weeks. And, continuing to demonstrate, legislators supporting really the majority will of Texans on this issue, on the ability to figure this out, figure out how to pull down our federal dollars and allow a coverage option to our low-wage Texans. The support for that is growing every day.
A companion bill in the Senate, sponsored by Senator Nathan Johnson of Dallas, has no such bipartisan support.
You mentioned waiting another 2 years. Of course, the next session is an opportunity to finally do coverage expansion. It should never be forgotten that at any time, our governor can also decide to do a coverage solution. But the resubmission of an 1115 waiver kind of proposal to CMS does provide another opportunity to, come to an agreement on the use of our federal funds and some form of coverage option for Texans. And that doesn't necessarily need to wait until the next legislative session.
Then, last week, Texas Attorney General Ken Paxton sued the Biden administration for revoking the 8-year 1115 waiver. He argued it was a political move to force Medicaid expansion in Texas. The wheel turns round and round. For the People's News, this is John Moeller reporting.